is a regional provider of clinical services in an academic environment, and we're committed to providing patients excellent clinical care, and telemedicine is one way we can reach out to patients in their own communities.
We work with patients of all age ranges, 16 up to geriatrics.
I find telemedicine obviously is a great technology for disseminating information, providing education, and developing sort of collaboration with family physicians in the community.
The continuity of care makes all the difference.
People are often a bit shy to come to a mental health facility for all the reasons that we're aware of, and they're often much more comfortable going to a community health centre or to their family doctor's office.
I have seen cases where patients are quite anxious. Sometimes they're not able to drive. So I've had cases where a patient was just thrilled about the fact that they could just go to the hospital in Deep River and not drive 2.5 hours to Ottawa in the snow.
Bell Canada has donated $1 million to the Royals telemedicine program. Bell's corporate citizenship has allowed us to leverage our clinical expertise and a superb Ontario telemedicine network.
Bell has been great for mental health in general when you look across Canada for what Bell's done to promote mental health care and to try and address stigma against mental health issues.
I think Bell chose the Royal because we are setting standards in mental health care across Canada. The Royal is a centre of excellence, truly.
Bell's $1 million contribution has added resources to our program and also allowed us to create state-of-the-art facilities.
The quality of the telemedicine that we're able to provide is so clear, so crisp, that people in the room are able to forget that the person's not actually in the room with them.
Here at the Royal, we have 2 telemedicine suites, which are very well equipped with all the technology that we need. But we also have the ability to use portable units in our telemedicine service so that I can have a portable unit brought to my office and I can see patients from my office.
As Chief of the Royal, it's been very rewarding to see that all of our programs are now using telemedicine in unique ways. These include our forensic program, our substance use and concurrent disorders program, central intake, mood program, and others.
People with mental health issues in correctional institutions, where we're starting to do a lot more of that kind of work, and those folks do not get the mental health services they require.
About 30 to 40% of inmates in any correctional institution suffer from serious mental illnesses. Without our input, they're not getting any treatment at all. I think confidentiality is very important for the inmates to open up to us, so we insist on the correctional staff to stay outside the room. The confidentiality aspect is maintained.
One of the things that telemedicine has allowed us to do is really reach out to some of the smaller communities in our region and provide services to patients who likely would not come forward were it not for the technology.
St. Francis is located in Barry's Bay. It's considered both rural and isolated from a hospital perspective, so we are geographically isolated. We're about 2.5 hours from the city of Ottawa, so we have certainly seen firsthand that the investments in telehealth, telemedicine, have paid huge dividends for us in terms of access to services.
The reality of living with mental illness in a remote location really comes down to access. We are in an underserviced area in terms of mental health provision, and unless you are already diagnosed with an existing mental illness, access again to care is something that can be limited and has been limited in the past. Undiagnosed mental illness can be very detrimental to patients.
Unless you reside in a rural community, you really can't appreciate the challenges in terms of accessing services, and so we don't have the luxury of getting on a subway and going into an urban centre or any other transit system that way.
Telemedicine is a saving grace in that it does provide them access, it helps reduce the wait times.
The Royal Ottawa has been fantastic. They're really a great partner to work with, certainly recognized within the region as the major mental health facility.
The Royal does an excellent job at providing our patients with timely access to service.
In the future, given our commitments overseas, I can see telemedicine being used to serve people in theatre and well beyond the country. We have people in Afghanistan. Why wouldn't we potentially do an evaluation and provide some support right in theatre as opposed to flying people all the way back home?
Telemedicine is a very effective way of matching patients with consultants. Our experience has been that it's a very positive approach.
I think telemedicine is something that everyone should be able to do, and I think it's something that we need to introduce very, very early on in training.
I envision telemedicine in the future as being an option, just like face-to-face contact.
We are really recruiting more physicians to come up on with the telemedicine project.
I think we've just touched the tip of the iceberg in terms of the ways that we can use this.
Can't emphasize enough that based upon our experience in knowing the population that we serve, knowing their needs, those folks would not be accessing services.
I am very excited about the future of telemedicine, and I'm really looking forward to where we can go with this as an organization.